This is The Metro on 1019 WDET. I'm Tia Graham. This week is National Black Maternal Health Week. It's not only a time to raise awareness, but a time to have honest conversations about what families are experiencing right now. In the U.S., Black women are still significantly more likely to face serious complications or even die from pregnancy-related causes. According to the Centers for Disease Control, the maternal mortality rate for Black women in 2024 was more than double the national average. And disparities remain consistent regardless of income or education. What would it look like to center families to bring birth back into the community? What would it look like for families to have options like birthing centers? Birth Center Detroit opened the first standalone birthing center in the city, providing an alternative space for expecting people. Leslie Welch is the co-founder of Birth Detroit and Birth Center Equity. She joins me now to explore the culture of birthing in this country and what needs to be done to protect Black moms. Leslie, welcome to the Metro.
Thank you so much for having me.
Of course. Very important topic. Now, jumping in, you describe yourself to people as a professional dreamer who's guided by love. What does that look like in your work day to day?
In my work day to day, it means that I am grounded in purpose. It means that I am very comfortable seeing now and holding a vision for opportunities that other people may not readily see. And I feel grateful that I also found that in my co-founders for Birth Detroit, Charlie Snow, Nicole White, and Alondra Fard. And that's why we were able to tirelessly work to make it happen, even though people said we couldn't.
And Leslie, as a professional dreamer guided by love, what were your goals and your co-founders' goals for starting Birth Detroit?
Our goals were to create an environment where we could receive care grounded in values of safety, love, trust, and justice. And we were guided by the belief that the spirit of care matters. And that we deserve more than just to not die. That pregnancy and birth are pivotal, phenomenal, sacred, transformative life experiences in all of our lives. And sadly, in the United States, we have reduced it to a very medicalized experience in ways that don't serve any of us.
And Leslie, before we get down to the more nuanced part of the conversation, I want to ask you about Birth Center Equity as well. You also founded that. What is the role of Birth Center Equity within the whole space?
I co-founded Birth Center Equity with a colleague in Boston named Nashira Burrell, and we did that in pandemic in 2020 when we were both building toward our own local birth centers. And all of a sudden, the country woke up to the fact that it would be nice to have a place to have babies where sick people were not. And then the whole system of existing freestanding birth centers became more visible, and in becoming more visible, what was very clear is that communities of color were least likely to have access to freestanding birth centers. And so Nashira Burrell and I founded Birth Center Equity to help folks of color overcome the capital barriers to opening birth centers in our communities.
And through Birth Center Equity, how many have you been able to help open?
Well, interestingly, what we learned when we started Birth Center Equity is because we started in pandemic, we started with rapid response support to keep the existing birth centers at that time to keep them open, providing things they might need to continue their services and providing resources for other communities to provide virtual services. And since that time, our work has grown to be much larger. So We have a network of about 60 birth center leaders, Black, Indigenous, and people of color across the country who are either currently providing birth care services now, that would be around 25, and then the balance who are working to open their centers. And what we provide to our network is a combination of peer learning support, capacity building, technical assistance, and direct grant making and recoverable grants are just a part of that. And I would say that over the past 6 years, nationally with Birth Center Equity, we've been able to raise about $10 million that has been invested into the network through grants, yes, but also through capacity building and other technical assistance programming.
Leslie, was there a particular moment that impacted you that made you understand the need for spaces like birth centers?
I fell in love with birth as a birth doula before I even had my own babies. And when I started my family, my first baby, my Zoe, was born premature, so had spent time in NICU. I had also, between my Zoe and my Vander, my 12-year-old, my wife and I had a late-term loss. And I was also with my brother when my nephew was born and died the same day at a local Detroit hospital. And all the while, I was working in public health. And so I had a perspective around where and how resources were being allocated that deeply contrasts with the experience that I and my family members and other community members were having in reality. And what was very clear to me is that midwives were missing, is that we were not investing in the power and potential of the midwifery model of care to influence and improve all these outcomes that we say we care about.
So, Leslie, historically, in Black maternal health, midwifery was the only option due to the lack of access to hospitals and other medical spaces. And in particular, when we talk about Black women, can you talk about why that care remains critical in Black maternal health?
Oh, geez. So, yes, at one time, midwifery care was not only birth care, it was health care for Black communities. And I would really emphasize that it was decidedly and purposefully, institutionally changed using racist tactics in the 1900s. And so there are laws that were enacted at that time that put in requirements that it was clear that many of our Black midwives were unable to meet. There were racialized public health campaigns depicting our midwives as unclean, uneducated, and unfit. There are still academic journal articles you could pull at this time to reflect the things I'm sharing now. And so fast forward to today, and it is a testament to the strength and power of our grand midwives and the living Black midwives today that we still have the knowledge of this care and the power of what it provides to us, because midwifery approaches birth as a normal physiological life process. It approaches all dimensions of the human and family experience. So midwifery care engages not only the birthing person, but the family and caring for the birthing person. And in particular, when we talk about Black midwifery, one of the terms we use in Birth Center Equity is culturally reverent care. And what that means is that you're being provided care that not only acknowledges or tolerates that we all have a culture, that has respect and honor and reverence for the role of culture in our lives, and that truly listens to the experience that birthing people are having, not only physically, but mentally and emotionally and spiritually. And what we know is that outcomes are decidedly and proven to be better with midwifery model care wherever you have it, right? Mm-hmm. So if you've had care with a midwife, you are less likely to have a preterm birth, less likely to have a low birth weight baby, more likely to have success breastfeeding, more likely to report a better birth experience, more likely to have experiences of autonomy and respect. And what many people don't know is that the value of midwifery care to our healthcare system is great, not only in the lives it saves and the experiences it provides to our families, but it is also very cost effective. And we have not integrated midwives into our healthcare system the way that they should be in this country.
This is The Metro. I'm Tia Graham. My guest is Leslie Welch, the co-founder of Birth Detroit and Birth Center Equity. We're talking about the culture of birth in the U.S. during Black Maternal Health Week. I want to stick at a few moments here for a little bit. You talked a little bit about safety and cultural awareness. You've said that Black women can often have undignified birthing experiences. Can you explain what that looks like?
Oh my gosh, there are no shortage of stories in the media where Black women report experiences of disrespect, experiences of not being heard. There, most recently in the news, have been experiences of unwanted and unconsented for cesarean sections for Black mothers, and these are recent stories. Most folks are aware of Serena Williams' birth story, for example, where she was not listened to around her experience of pain and need for medical attention. These experiences are not uncommon. I would suggest that the ones you hear about in the media are actually the tip of the iceberg in terms of the obstetric violence that Black women experience in the United States.
Now, Leslie, really quickly, you brought in consent, and that's a question I was also very intrigued about. What role does informed consent play in transforming birth culture?
Informed consent is everything, and I think one of the things that is important for us to be informed about is that hospitals are not our only option, and obstetrics is not the only way. And not only is it not the only way, but that in countries with better birth outcomes, people start with midwives. So when you become pregnant, you begin with midwifery care, and you are referred to physician care if and when it's medically indicated, which is the opposite of what we do in the U.S. So in the U.S., less than 15% of us have access to midwifery care. What we see in economically pure countries is that 75 to 80% of care is in the hands of midwives, and they have better outcomes. And what we know here, too, is that our American College of Nurse Midwives suggests that 60% of births in the U.S. could be safely attended by midwives in a community setting. Some studies estimate much higher than that. And so at Birth Center Equity, we believe the least we could do is 50% in the next 25 years.
Oh, Leslie, we're going to get to 50 by 50 because I'm super excited to talk about 50 by 50. But I do want to have a follow-up here with you really quickly while we're talking just about, once again, this midwifery, having that culture within the hospital space. You believe birthing has been and is over medicalized. For folks who may not understand, like, what does that look like? What does that mean to you, an over medicalized birth?
It means that we have a culture of birth in the United States that largely treats birth as a medical emergency. And what is true is that for the majority of us, birth is not a medical emergency. It is something that we can safely do with midwives in a community setting without extensive medical intervention. And instead, we have a culture which I would describe as physician-centered, as hospital-anchored, and as rooted in hierarchy, right, in terms of how we're treated based on our social identity, and also hierarchy in terms of healthcare providers and their credentials. And what we envision is a culture that's vastly different, right? A culture where we do experience birth as a normal part of our lives, and a part of our lives that is not automatically deemed a medical emergency, but is only that when and if, and this would be in a small number of circumstances, is medically indicated. And so, for example, when we think about what's possible, it's possible to go into labor, to labor at home, or to begin contractions at home, to contact your midwife who lets you know when you should come into the birth center. And then you come into the birth center when your labor has progressed to the point where you should be in the birth center and be cared for there through your labor process with a midwife. And you're in a home-like setting, right, where your family can be present with you, where the midwife is your healthcare provider, where you are safe, and you labor and have your baby there. And then once your baby has come, you are surrounded by, your family, your midwifery team. You are able to have a water birth if you wish to have a water birth. You are able to, have food being prepared for you in the next room if that's what you wish. And you're able to go home shortly after because, again, birth is not a medical emergency. It's a normal process that can be managed in a way that is not steeped in risk and fear.
So, Leslie, listening to you right now, the structure of our society, it is steeped in fear, so much fear right now, and moms or dads or families in general may have that concern of, I'm going into a space, will there be a doctor if an emergency happens? Oftentimes, the doctor in the room makes some people feel safe. So wouldn't it be a good idea to have the doctor in the room for those who would feel more safe having a doctor there?
So I would say for those who require a doctor's presence to feel safe, a birth center is not for you, right? And I think that is the thing I want to be really explicit about, is that our advocacy at Birth Detroit and at Birth Center Equity is that we should all have the option of choosing our birth care provider and our birth care spaces, right? Not to say that a birth center is for everyone, right? Is to say that historically we have not had the option of birth center care and midwifery care at the levels we should. And so we should be able, every family, every birthing person should be able to choose for themselves. What I would say, though, is that from a health perspective and a public health perspective, research and data shows if you start with a midwife, whether it's in the hospital, at a birth center, or at home, your outcomes are better.
That's the line of thinking I was going on. But, anything could happen in those spaces. And if you are in a birthing center and then something does go wrong, what are the options there? Or are you saying because a midwife is present the whole time, those complications are reduced?
So what I would say there is that there are absolutely partnerships, protocols, and procedures in place in the event that there is a medical emergency, which the likelihood is very low. So during the course of your care with a birth center midwife, you are being assessed for your appropriateness for the birth center all the time. And if and when that changes, we have partnerships with physicians where a mom or birthing person is then referred to a physician and out of the birth center if that's needed. And in the event that a person is laboring in the birth center and needs to be transferred, we have a transfer partnership, we have direct relationship, and a plan that has been tested and trained with our hospital partners to ensure that medical attention is given in a very, very timely fashion.
Right now, we're speaking with Leslie Welch, the co-founder of Birth Detroit and Birth Center Equity. We're talking about the culture of birth in the U.S. during Black Maternal Health Week. When we return, we will talk about the cost of birthing centers, accessibility, and what the future of healthcare could look like under the midwifery model. You all stay right there. This is The Metro. This is The Metro on WDET. I'm Tia Graham. I'm joined by Leslie Welch, the co-founder of Birth Detroit and Birth Center Equity. We're talking about the culture of birth in the U.S. during Black Maternal Health Week. Now, Leslie, jumping back into the conversation, there's always the cost of where to have the baby, of course, but how much does it actually cost financially? So if we can briefly talk about that, how do the costs of birthing centers compare to hospital births for families and for healthcare system overall?
So what we see in states that have the most friendly policies in terms of birth center licensure and reimbursement is that birth centers can be covered by all insurances. They can be covered by Medicaid and public insurance, and the cost then both to families and to insurance companies is actually less, because what you're moving away from is the cost of unnecessary medical intervention, the cost of unnecessary cesareans, and the cost of adverse outcomes that you don't have. As well as with birth center birth. So I want to say that when we think about how we finance healthcare in the country right now, one of the things that many of us advocate for is value-based care or value-based financing, right? Mm-hmm. So to finance care at the value it's actually providing to families and to our communities. And so with that said, I would not advocate for, choose a midwife because it's cheaper. Instead, I would say, choose a midwife because you are getting an enhanced quality and value of care.
Excuse me. And who currently has access to birthing centers? Is anyone being left out right now?
Oh, absolutely. Mm. So there are more than 400 freestanding birthing centers across the country. Today, less than 7% are owned or led by Black, Indigenous, and people of color. So that means that our access to birth centers is quite low, statistically speaking. And it's one of the things that we're working to change at Birth Center Equity.
What would equitable access to birthing centers look like in practice?
In practice, it would look like a midwife for every family if they wanted one, and a birth center for every community would be an option if a person wanted it. And we're quite far from that today.
Leslie, what's one misconception about the cost of birthing centers you want to clear up?
I think for a long time, at least before the pandemic, birth centers were perceived largely as a boutique model of care that only some people have access to, right? So either, it being perceived as like a high-end experience that you only have access to if you're high income, or in some communities being perceived as the choice of, of white women and not Black women, all sorts of misconceptions. Instead, what I advocate for is that birth centers really be seen as a strategy to improve outcomes. And I'm a public health person, so I would say a public health improvement strategy, right? But to say it, without jargon is to say that it would be amazing to have in the U.S. a culture of birth where our care really did begin with midwives.
So once again, we talked a little bit about the cost of the birth center, and it's a little bit lower. How do birth centers actually bring the price down? Do people assume it's cheaper?
So no, I think again, what is true about birth center care is that you do not receive in a birth center the level of medical intervention that most receive in a hospital. So those costs are eliminated.
Well, do people consider the cheaper, in their mind, the idea that this is a cheaper price and may equate to a cheaper service?
Well, and that's one of the reasons why, Tia, I would say, I don't know if I would say cheaper. I would say more cost effective, right? I would say that you get more money for your healthcare dollar, whether you are self-paying for your experience or private insurance is paying or Medicaid is paying. Because in a birth center, you get a level of personalized care, a level of attention to not only your physical health, but your mental and emotional health as well, and a level of engagement with your provider and your family that you would not readily or normally get in your hospital experience. And so when we think about the cost effectiveness of birth centers, there are financial feasibility studies, that suggest that by just changing the percentage of us that have access to midwifery care by 1% to 5% would save millions and millions of dollars across our healthcare system, right? Also, it's important to understand the difference in cost for a medicalized birth versus a non-medicalized birth. Those costs are very different, right? Whether the non-medicalized birth is in a hospital or a birth center, that cost is lower than if you've had medication assistance or surgical intervention in your birth.
Leslie, thank you so much for explaining that and breaking that down, because a lot of folks may have this idea like, oh, well, maybe the services are cheaper, so I get, a lesser care, or like you said, inexpensive services. Regardless of what it may be, you explained that beautifully, so thank you. And before we get out of here, Leslie, what is Beloved Birth 50 by 50?
Beloved Birth 50 by 50 is a 25-year national campaign to, by 2050, have 50% of our babies come into the world with the care of midwives across birth settings, hospital, birth center, and home. And we have outlined sort of 6 pathways to influence this number. So to bring folks who believe in this goal together across disciplines of finance, workforce, health systems integration, healthcare facilities, policy, and culture. And so there will be a variety of initiatives emerging within these categories to support the Beloved Birth 50 by 50 goal. And it really is grounded in understanding that our culture of birth in this country was decidedly changed in the 1900s, and it can be decidedly changed again. And that what we need right now is folks who see and believe that vision is possible to work toward it so that our children's children and our great-great-grandchildren and their great-great-grandchildren have a safer, more loving, and more culturally reverent experience of birth in the future.
If you could redesign maternal health care from the ground up with Black women at the center, what would it look like?
It would look like starting with midwifery care before we ever became pregnant. It would look like honoring our reproductive and sexual health development as rites of passage once again. It would look like receiving wellness care to keep us healthy from the very beginning and all throughout our reproductive lives from period to period and beyond. It would look like having an understanding, a fundamental understanding of our bodies and what we're capable of, and of not only our physical power, but our emotional, mental, and spiritual power in the experience. And it would look like entering birth again, not as a medical emergency, but as a joyful experience in which safety is the least of what we expect, in which safety isn't even a question. We know we will be safe in the hands of our midwife. We know that if we need a physician will be involved in our care. We know that our family, our spouses, our partners, our husbands are welcome, not only in the birth room, but in our prenatal appointments, in our postpartum appointments. It would look like someone is coming to see us in our homes the day after we have our baby, and the week after we have our baby, and the week after that, instead of 1 6-week postpartum visit that you get in our health systems today. And it would look like our families are held in safety and in love, they're trusted, and that there truly is a birth system where we have equity in options available to us as well as the outcomes.
Leslie Welch is the co-founder of Birth Detroit and Birth Center Equity. This week is Black Maternal Health Week, 7 days dedicated to awareness of the birth crisis among Black mothers. You can learn more about Birth Center Detroit and its efforts here in the city. Head to WDET.org and search Detroit Evening Report. Take a listen to Nargis Rahman's conversation with Alon Gifford, Birth Detroit co-founder and prenatal support and education director. Leslie, thank you so much for joining us on the Metro. We can't wait to have you back to talk a little bit more about maternal health in the city.
Thank you so much, Tia, for having me.
We're always listening. Do you have any story tips or maybe just some kind words? We'll take it all. Email us at metro@wdet.org. That is metro@wdet.org. The Metro is produced by Sam Corey, Carey Jr. II, Robin Vincent, and me, Tia Graham. Our senior producer is David Lyons. Our engineer is Jose Yanis, and our music is done by Sam Bobian. The Metro is a production of WDET, a listener-supported service of Wayne State University. And this is WDET-FM, Detroit Public Radio, your connection to news, music, and conversation. Have a great day.